Hello, students.
Good afternoon, ma'am.
Good afternoon. All of you are there? Okay, I'll start the class now, okay? Okay, today we are going to do about the school health services, okay? Now, before we start, what is a school health services? We should know what is a school, okay? Yes or no? You know what is a school? What do you do there in the school? What do you mean by school?
Ma'am, school is
क्या है school? School is what? What do you do in
Place
school?
of learning.
You are there to learn something,
ma'am
right?
in gain knowledge.
Huh.
Yes, ma'am.
So, do you
To
interact with
gain
some?
knowledge.
Do you interact with somebody there? Do you interact with somebody there?
Yes, ma'am.
To
Yes,
whom
ma'am.
you interact?
Teachers,
Teachers and who else?
Teachers, friends,
friends,
with friends,
Yes.
teachers.
Then, beside the teacher and friends, to whom you interact? Anyone in the school? Nobody is in the school.
Books.
Person. I'm talking about the
Ma'am,
persons.
persons, ma'am. Like students, ma'am. Friends, classmates.
Okay, I told students, teachers, and who else? Only
Principal.
Man,
principal, yes, and who else? Any other one working in the school? Anyone is there working in a school?
peon,
Office workers.
All those personnel who are there in the school, working in the school. Okay, so school means it is an education institute, right? Yes or no? Where you learn certain defined thing at different level. Okay, you have a defined education at different at a defined level, right? So in different category, you are learning something different. Okay. So you have your own standard, 1, 2, 3, 4, 5, 6, like that. So school is something where you learn something. Okay, it's a learning process where it's an institution, education institution where you learn. You interact with the teachers, with the principals, with other personals who are already there in the working in the school. Okay, yes or no? So it is in one building. Yes. Okay. Health is what?
yes, ma'am.
What is school health? What do you mean by school health? You know what is health, right? You know what is health,
Yes, ma'am.
right?
Yes, ma'am.
Yes. Now, when we talk
Yes,
about health, now school health, what is the school health now? You are, what is the health? What is the definition of health? It is a complete state of what?
Physical, mental, social, and
Mental and
emotional
physical
well-being.
well-being.
Well-being of whom? Of yes. Now here it's a complete state of physical, social, and mental well-being, not merely the absence of disease or infirmity, right? So we are talking about the individual here, but as a school health, we are talking about the health of all the people. We are concerned about all the health who are working in the school. Okay.
Yes,
Services,
ma'am.
we give lots of services in the school. You have been to school visit? You have gone to school visit in the community? Yes or
Yes,
no?
ma'am.
What do you do
No,
there?
ma'am.
What service
No,
you have
ma'am.
given there? Some they have visited already the school. Okay, I know. So what was? Why did you visit there? What did you do there? Did you do something there?
ma'am. Health talk and ma'am role play to
Health education.
You gave health education regarding what? Do you remember that?
regarding hygiene,
Yes, personal
ma'am. Regarding hygiene,
hygiene. Then
Mental
mental
relief,
health.
like stress.
Even we went for demonstration of hand washing, right? Yes or
Yes,
no?
ma'am.
So these comes all the health education's part. Okay. So why we are giving health education? Why we are giving these services? So that they can learn something. So they learn something. They have knowledge about the betterment of their health. They are aware of the to keep themselves, motivate themselves to have a good behavior, a healthy behavior, and healthy attitude towards health. Okay. So let us see one by one. Okay.
yes, ma'am.
Okay, now school school children, when you talk about the school children, it is usually between the age of 5 to 17 years are the school going age, okay? And nearly about 30% of the population comprise in this age group. Understood? So usually those children at the age of 5 to 15 years, they go to school, right? They usually ask them after 5 years only they have to go to school in KG class, right? So they are the group, the children's group are from 5 to 17 years who are the school going age children, and their percentage is about 30% of the populations, okay? Now you see here, school is defined as an educational institute where a group of peoples pursues defined studies at different levels, okay? Receive instruction from one or more teachers, frequently interact with other officers and employees such as principal, various supervisors, instructions and maintenance self-staff, etc. usually housed in a single building. Understood what is school?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay. Now I told school health. School health referred to the state of complete physical, mental, social and spiritual well-being, and not merely the absence of disease or infirmity among the people, that is students, teachers and other school persons. That means school health will not, no, we will not see the health of only the students. We have to see the health of everybody who are working in that school. Okay? Understood now? Yes?
Yes, ma'am.
I want continuous
Yes, ma'am.
interaction with you, though I'm not with you now.
Yes, ma'am.
Okay, say yes or anything you have problem, you tell me. Okay? Now, school health service, I told you, when you talk of services, usually why we give health education part? Just to promote, to protect and to prevent many and to control many diseases and maintain their health. Okay? So here, ideally, school health services refer to the need-based comprehensive services. So it is a need-based comprehensive service. You understood what is a need-based, right? So it has to depend on the what they actually need at that present time, okay? So their need has to be seen and accordingly the services has to be provided. If you happen to see that this school is not having, not maintaining their proper personal hygiene, so we are going to give health education regarding personal hygiene, okay? So if the school are having some problem with the other health problem like nutrition deficiency or maybe other mental health problem, so we are definitely going to talk about those things, or we are going to have some services like immunizations and all where they actually the school needs. So it is a need-based comprehensive services which is rendered to the people, the teachers and personnel in the school. Why? To promote, to protect, to prevent, control diseases and maintain their health. Understood? But practically it should be, you should provide services that is need-based comprehensive services. Okay? Understood now? Yes, student?
Yes, ma'am.
So it has to
Yes,
be,
ma'am.
whatever service you provide, it has to be need-based, comprehensive. Okay? Okay? Why? Because to promote, to
Yes, ma'am.
protect,
Yes,
to
ma'am.
prevent and control diseases and mental health. This is very important topic, okay? School health service also. Now when we go, let us see how the school health services in India came. Now before independence era and post-independence era, okay? Now in 1909, when for the first time medical examination for the school-going children was conducted in Baroda city, okay? Then it was the first time medical examination for the school-going children. Then is the voice clear to you all?
Yes, ma'am.
Yes, ma'am.
Okay. Then in 1957, Child Education, Nutritional Education Committee and WHO assisted the school health education project to be set up. Okay. Then in 1960, the Ministry of Health, Government of India set up a school committee under the chairmanship of Smriti Renuka Ray, and then the member of the parliament, just to assess, to see the health and the nutrition of the school going children, and the means of they should give some advice or suggestion how to, if they find anything about the deficiency in the standard of health and nutrition, the means of improving those things. Okay, it was done in 1962 under the Ministry of Health and Government of the Ministry of Health. Okay, under the chairmanship of Ms. Renuka Ray. Okay, just to see the nutrition and the standard of the health and the recommendation to be made. Okay, so that they can improve all those things. Then in 1977, a centrally sponsored National School Health Scheme was started in 1977. Okay, remember that. Now in 1979, a National School Health Scheme was handed over to the state government. From the central, it has been handed over to the state government. Okay, of the schemes. Then in 1981, a task force was established by the Government of India, Ministry of Health and Family Welfare, to study the progress of school health program functioning in various states of the country. So once the National School Health Scheme was started and handed over to the state government, in 1981 they formed a group under the Ministry of Health and Family Welfare to see the progress of this program, which was functioning at a different level of the country. Okay. Then in 1984 and 85, Delhi has its own comprehensive school health scheme, which was still continuing till today. So Delhi also have their own committee to continue with this program. You understood, no? Till then? Yes?
Yes,
Yes,
ma'am.
ma'am.
So this is
Yes,
just
ma'am.
before independence and post-independence era. Okay. Now we will
Yes,
go.
ma'am.
Now you tell me, what are the school health problems you find in the school? Can you tell me?
Nutritional deficiency.
Yes.
Dental pain.
Dental caries, dental infections, and any other?
Nutritional problem.
Huh, she told me already, nutritional problem. Huh, then any other?
Vision problems.
Huh? What problem? I didn't get you.
Vision problem.
Huh, that is eye problem. Okay, vision problem. Okay, then yes, they also have a psychological problem because there is lot of stressful environment in the school also. Okay, maybe peer pressure, maybe study pressure, so many. So they usually they have this psychological problem also. Okay, anything else? Okay, we'll go one by one. Okay. Now, first school health problem, it can be malnutrition as a nutritional deficiency. It can be any infectious disease also, right? Infectious disease, once someone will get one infectious disease, the other can also have. Okay.
Yes, ma'am.
Yes or no? So it is infectious disease, like someone have measles and he goes to school. If he has cough and cold, goes to school. The others also will start having, right? So it is infectious disease, communicable disease. I mean, intestinal parasites also. It's very important. Worm, right? Then disease of the skin, eye, ear, dental caries. Okay. So malnutrition. Just to show you the picture, infectious disease. Okay. Intestinal parasites, disease of eye, skin, ear we have, dental caries, then behavior problem we have, antisocial problem. Many people, many students, they have this habit, right? Stealing, lying, gambling, destructiveness, sexual offense. Then there is also habit disorders or nail biting, thumb sucking, backbiting. So these are one of the behavioral problems also that we can find in the school. They have a personality disorders, a temper tantrum, shyness, daydreaming, jealousy. Okay. Then education difficulties, they may have lot of education difficulties, backwardness in the studies, then school fear, school failure, etc. Okay? You understood? These are the problem. We will continue with the problem afterwards. Okay?
Yes, ma'am.
Yes, ma'am.
Now, what is the aim? I told you what is the aim of the school health services. Okay? Mainly to promote, to protect, and to maintain the health of the school children and reduce the morbidity and mortality in them. Okay? Got it? Not only for the school going children, but it is also the people working in that particular school. Okay? You understood?
Yes, ma'am.
Okay, now we'll go with the objective of school health
Yes,
services.
ma'am.
Okay. Objective is, I told you, it's a promotion for the positive health. Okay. We'll always give them educations regarding awareness so that they get a positive attitude, behavior, so that they will have optimal growth and development as well as the education achievement. Okay. The prevention of any diseases, if there are any communicable diseases, that has to be done. Okay. Services has to be given for that. And for that, we have to do early diagnosis, treatment, and follow-up defects also can be done. Then I will tell you, awakening health consciousness in children is very important. Okay? Because they are the generations, they are the future generations of the country, right? So once they have a healthy attitude towards health and healthy behavior towards health, this will give us, it will help us to have a betterment of health as as a whole in the community, as a nation also. Okay, so awakening health conscious in these children these are the future generation, which will help them to have so that we can have a less of morbidity and mortality in our country also. Okay, the provision of healthy environment in the school, it is very important to give them a healthful environment. Okay, we'll come one by one afterwards. Understand this one objective?
Yes, ma'am.
Okay.
Yes, ma'am.
One is for positive health, one is
Yes,
prevention
ma'am.
of
Yes, ma'am.
Yes. One is for promotion of health, prevention of disease, early diagnosis, treatment follow-up, awakening the health consciousness, and giving them a healthful environment. Now the goal I told you, to prepare the younger generation to adopt a measure to remain healthy, so that it will help them to make the best use of the whatever facilities are given in the educations, and also at the same time they can utilize their leisure time or recreation time in very productive and constructive manner. Okay, so that they will enjoy their recreation period, as well as they will have a development concern for others, as well as the better healthy attitude towards health. Okay, so it is just a preparation. We are going to prepare the young generation to adopt measures where they remain healthy. Okay. So they can use all the facilities are given to them properly. Okay. To help the younger generation become healthy and useful citizen. So in order to, so that they will be able to perform their role effectively for the welfare of themselves, their
Yes, ma'am.
families, and the community at large, and as a country. So I told you.
Yes, ma'am.
So we are going to make the younger generation healthy. Once they are healthy means they are useful citizen, right? Who can take care of themselves. Not only for themselves, they are also have been useful to their families, to the community, and the country as a whole. Okay? Yes?
Yes, ma'am.
Now, why do you think there is a need for the school health services? Tell me. Why do you think? Why do we need it? I've told you so many times.
To assess the nutritional status and health related problems.
Then, what else?
To create awareness regarding various disease conditions.
Okay, what else? Okay. So I have already told you the school children constitute a vital and substantial segment of the population. They are the most vulnerable section of the population, okay? And they are the most important section of the population also, because they are the future generation of our country, right? Yes or no? So the school children are the vulnerable section of population by virtue of their physical, mental, emotional, social growth and development during this period. So they are the vulnerable
Yes, ma'am.
section of the population. They can go anywhere, wherever you take them, they will go, right? And this is a time where they can have a proper optimal growth and development and the education achievement. Okay, so if you don't give them a proper way of show them a proper way of developing both physical, mental, emotion, they will go in the wrong direction. So that is why we say a vulnerable section of population by the virtue of the physical, mental, emotional growth and development and during this period. Okay, so we should be very careful. That is why it is very needed for the school health services. Okay, now The third is school children are exposed to very stressful situation. I have already told you they are stressed about their school environment when they're first going to school, right? About the peer pressure, about the study pressure. So it is a stressful situation for them. They are coming out from their home for the first time, especially those are coming, getting admission for the first time. So they have the fear for school, fear for the friends, fear of not achieving their success. So it is a very stressful situation for them, condition there. So that is why this school health service is very important to give at that time, okay? So we say prevention is better than cure. Intervention when health breaks down are costly and time consuming. So we should always give a health education. Prevention, how we give? Health education, right? Awareness. So it is better than cure. So especially when the things happen, it takes time. It is time consuming and it is basic. Before that, let us prevent those things which is preventable in the school. Okay. Fourth thing is school health services will help to identify any deviation from the normal growth and development. Any health problem, as you said, na, to identify the health problem. So that we can do everything, when we identify any health problem, we can in time, so something can be done, okay? Corrective measurement can be done, therapeutic measurement or rehabilitative action can be done so that they can maintain their health properly and they can continue to achieve their educations facilities. Okay, understood now? Yes.
Yes, ma'am.
So after we have found out those
Yes,
problems.
ma'am.
So after we have found out those problem, so what we are going to do, you know, na? Early diagnosis, prom and adequate treatment is very important. Follow-up care is very important. Okay. Then I told you rehabilitations is very important. Then health knowledge and skill learned not only will benefit the child,
Yes, ma'am.
but also will benefit the school, the parents, family, and community.
Yes, ma'am.
Why we are talking about the benefit of the school, we know that will benefit the child as well as the school, as well as the parents, because why the parents, family and community, they are the team of the school health services also, okay? So we should also involve those parents, family members and the community also as well. That's what they will also be benefited if we give them some knowledge and skill, okay, which will help to benefit the child as well as the school, the parents, family and the community, because they are also the team member of the school health services, okay? We should also involve them, okay? You understood, no? They are the most important segment of the populations. They are the vulnerable section of the populations, okay? Then we have talked about, what is that? Prevention, I told, is better than cure, okay? Then it will help to identify all the problems. Then again, we can do the diagnosis, we can give them care, we can go out for follow-up care, then rehabilitation and health knowledge, okay? Understood? These are the, what was that? Need for school health services, okay? Understood now?
Yes, ma'am.
Yes, ma'am.
Now, philosophy of school health services.
Yes, ma'am.
Now, a healthy child is mentally, when we talk of healthy child, they are usually very mentally alert, receptive. They can receive anything, okay? Whatever you make them, what to say, when you take class, when you teach them something, they are very receptive, okay? They will not miss the class if they are healthy due to some minor illness. And when they are everything are okay, when you are healthy, you'll give a better performance in the study, right? So that is the philosophy. So when the child is healthy, everything is going to be fine for better performance in their studies, okay? So health is not just freedom from sickness or infirmity, but the realization of the full potential of the child, which has a physical, mental, social, and spiritual component. That is the health definition, right? So it is very important for the children to have they should be healthy. Okay, not only physically, it should be mentally, social, and spiritually also. Okay, principle now, okay? As I told you, be based on the health of the school. So it is a need comprehensive care services. So it has to be according to need of the school children, what services to be given. So be planned in coordination. When you wanted to give some school help services, we just cannot go and give them services, right? Yes or no? You can just go to school anytime, whenever you want to go.
No, ma'am.
So what do you think you have to do?
No, ma'am.
What do you think you have to do?
Uh, Early age, ma'am.
No.
At early age, like after 5 years old, 4 years old.
Hmm. No, when you wanted to go to school to give services, something services, just you cannot go. You just can go to school like that. What are the steps to be followed? Suppose today you want to go to one school. You are in the
No,
community.
ma'am. No, ma'am.
That's what I'm telling. What are the steps to be taken when you wanted to visit one school? You do some planning, right?
First, we will identify.
Uh-huh.
No, ma'am.
Now what you will do? Suppose I tell you,
Ma'am, we have to take prior permission from
yes,
the
yes. Prior
principal.
permission from whom?
Yes, ma'am.
Prior permission from whom? Hmm? From whom you want to take
From the
prior?
principal, ma'am.
Yes. So it
Ma'am,
has,
Principal.
huh?
principal, ma'am.
Yeah. So I told you, you have to see, you have to survey what are the need of that particular school. Okay. Then you have to plan in coordination. You have to coordinate with your school, with the health personnel, with the parents and the community people as well. Okay. Understood? Got it?
Yes, ma'am.
So your services should be on
Yes, ma'am.
preventive. Yeah, your services should be on the promotive and preventive aspects. Okay, so it has to be the need based. It has to be planned. It has to be well planned, taking permission and all, and also as a team work, it has to be coordinated with the health personnel also, because health personnel has to go, only you cannot go just like that, right? So health personnel who can give immunization, who can give health education, who want to do demonstration, whatever it is. So parents also should be involved. They should be prior what information to be given to the parents that these are the things that we are going to do today. Please tell them to come. Please make sure that the students comes. Okay. So even the community people also, the headman or anyone, the committee has also to be involved if possible. Okay. So the emphasis should be on the just whatever services you have to give, it is on preventive and promotive aspects. Okay. Okay. Then we have to emphasize, as I told you, health
Yes,
education.
ma'am.
Health education should be given. Then when you are giving some demonstration, they also should be
Yes,
very,
ma'am.
they should be very active, and participants should also be required from them. Okay. And whenever you're giving any hand washing, you want to show hand washing, we ask the students to do at the same time with us, right? In the group also, in the school also, no? So this active part should be there from their side also, okay? Then it has to be continuous program, I don't know. It should be always there, you know. Whenever we do any community service, it
Yes,
has
ma'am.
to be all ongoing and continuous program. One day we went to school, other day we are not going anymore. It's not like that, okay? Then at the same time, we should have the system of recording, keeping, and reporting. What you have done today? How many people you have found out that something like dental caries they have mental problem? The recording and reporting is very important. This will help us to. It will give us a tool to evaluate the healthcare school health services. Okay. So anyway, whatever you do, you should all be record and reporting. Okay. Then what you have done, reporting should be given to the higher authority. Okay. Yes.
Yes, ma'am.
Are you listening to me? Yes.
Yes, ma'am.
Okay, now we will go with the.
Yes.
You understood now? The principle?
Yes, ma'am.
Now we'll go with the component, okay?
Yes, ma'am.
Ma'am.
Yes, ma'am.
Now component, we have many things here, okay? Like first also let us, we have other component also. First let us see about the health promotive and protective services. Now when we talk about the school, and first one is the school environment, okay? So how the school environmental should be there. The school should be away from railway station, railway lines, bus stands, marketplace, cinema, etc. Okay? Proper ventilation and lighting should be there. Height of the room should not be less than 12 feet. Every student should get a minimum of 10 to 15 square feet of the area. Floor should be clean but not slippery. Proper railing on the staircase and the roofs. Toilets and 2 urinals for every 100 students should be there. Okay? Separate arrangement for drinking water, wash basin and school kitchen should be there. School kitchen or we say canteen, okay, whatever it is. It should not be more than 40 students in one classroom. Veranda in front of, this is the standard, okay, protocol. Veranda in front of every classroom. Classroom should be painted in a flashy, it should not be painted in flashy colors. Okay, these are the wholesome environment of the school building, I mean to say, okay? Got it?
Yes,
You understood,
ma'am.
no?
Yes, ma'am.
So proper, when you know all these things, right? It should be away from all the business areas, then height of the room should be this, proper ventilation, proper lighting should be there, the square feet, all those things, proper railing, all those things, separate arrangement for drinking water, wash basin, school children, and it should be well, not in the flashy colors, okay? Then comes the maintenance of personal hygiene, will come slowly. This will come later on. Now I told you school health team. Okay? Now school health team consists of the school principal, the school teacher, you know, the parents, the community, the children. When you talk about the school health team,
Yes, ma'am.
Yes, ma'am.
okay.
Yes, ma'am.
The school health team consists of the school principal, the school teacher,
Yes, ma'am.
the parents, the community, the children, the medical officer, the school health nurse, community health nurse. Okay?
Yes, ma'am.
Now the school principal. What is the job of the school principal here? Ensure that the school health program has the approval and support of school administrative authority. Set up a school health committee, school health council to work out the school health plan and plan for its implementation. Okay, this is the work job of the school principal. Okay, ensure that the teachers are adequately trained for the health care of the school children. Provide facilities for implementation of the school health activities. Make sure that the proper health records are maintained. Ensure that parents are involved and follow-up of the school children is done. Okay, this is the job of the school principal. Okay, yes,
Yes, ma'am.
okay. The school teacher, daily inspection of children for personal hygiene and cleanliness.
Yes, ma'am.
Daily observation of the children for detecting any evidence for any deviation from normal health, behavior, any communicable diseases, malnutrition, etc. Help in control of
Yes, ma'am.
help in control of communicable diseases. Referral of child having any problem to school. Health clinics for further action. Informing the parents and maintaining the follow-up. Maintaining the records of anthropometric measurement and other health records of the children. Help in providing safe environmental sanitations. Giving first aid and emergency care to children. Imparting the health education and healthful living habits and behavior, and also to participate if there is any epidemic is there of any communicable diseases. They should also, along with the health team, the teachers also should participate in investigation of this communicable diseases. Okay, these are the job of the school teacher. So they have to do the daily inspection, mainly for the personal hygiene and cleanliness, and any observation should be done. Daily observation by the school teacher should be done. If there is any problem of the child, like for an example, if the baby child is having common cold, sore throat, fever, rigid neck, whatever. They are the main one because they are always come in contact with the child. Okay, so their daily observation is required. So they will also help them to control the communicable disease. Refer if the child is having any problem, they cannot do any further action in the unit. They can always refer for the healthcare units. So at the same time, they have to inform the parents for the follow-up care, and maintenance of the record, health record is also very important. These are the job of the school teachers, okay? Giving them first set and emergency care because they are well trained. Should have an in-service education training program. So they are well trained, they should be trained properly so that they can give first and emergency care to the children whenever they have any injured or anything when they are sick, okay? So they also have to take part in the investigation of the communicable diseases along with the community health nurse. The parents. Now, the parents also involved in the team, so they also help us in the correction of defect, if any, and follow up the children if they are found sick. So the parents also should come forward and tell them what are the defects they found when they are at home, and if they are any sick, they can always inform the school principal, the school teachers. Okay, so that something can be done. So they can help in information of good healthy living habits and behavior. So parents are the one who also help the children to give them a good education regarding because we learn first things we learn from home, right? Yes or no? Yes.
Yes, ma'am.
So
Yes, ma'am.
So the first foremost information will be given by the parents at home only. So they are the one also will give the information to the children, okay? Through parents-teacher association, the parents can be involved. Even the
Yes, ma'am.
Ma'am.
parents can also be involved in planning, organizing, and implementing school health program. So even if the school, they can also help the parents can also be involved in planning and implementation any health program. Okay, school health program. So parents also involved, so they can also help the school. The community, why? They are needed in the team because they are the one who will give us the land for school building. Okay, and they are also can be given. They also provide us funds and labor in the building proper school. That's what community has to be involved. Okay, and participate in school health committee or council and contribute information of school helpers. So community at the same time they can help the school people in implementing the any formulating and not implementing formulating the school policies. Okay, at the same time implementation of the health program also they can be there, participation for that, and community people is the people who can motivate the parents, especially those who are at the head, for example, the religious leaders, the headmen and all, they can motivate the children, the parents to send their children to the school and also to take care of the health. So that is why community is also a very important team in the school health services, okay? Yes?
Yes, ma'am.
Okay. The children, why they are important? Learn values because they are the one who are learning, who are getting the education achievement. So they learn the values of medical and health examination, personal hygiene, good nutrition, environmental sanitation, etc., etc. Okay, and they also cooperate in various aspects of school health program. They are the also people, children also they cooperate with the school, helping us to do this and that when we go for a school health services. Okay, so they develop. Once they do there, we're having they get the awareness of all these healthy habits and attitudes. They will also develop a positive habits for the healthy living. Okay, and when they learn something, this knowledge they will extend their knowledge to the other members of the family and member in the community. Once they learn in the school, okay, the awareness, the knowledge of the healthy habits, this knowledge they will again go and give the message to the members of the family at home or the neighborhood in the community. Okay, so children also is very important in this team. Understood?
Yes, ma'am.
Okay, now the medical officer. Why you think medical officer is important? Because they are the one who are going to do the medical examination. Okay, they are the one who is going to do the diagnosis, prescribe treatment, referral, follow-up, and initiating of these programs. Okay, so medical officer also is one of the team of the school health officers. Okay, this way you know. Now the what is this coming now? Okay. Now, inspection of school environment and sanitation, medical officer also can do. They also hold a meeting with the parents and teachers. They maintain the records and reports and evaluation of the program, whether it is successful or not, or any improvement to be done. Okay, this is the job of medical officer. Now, the school health nurse. The school is health nurse is responsible for giving the comprehensive health, neat care of the child. So here she has to, because it's a need-based comprehensive care. So she has to she has to take all the factors which influence the health of child. For an example, biological aspect of the child, school and family environment, health knowledge and health attitude of the child and families. Okay. Living activities, personal habits, health behaviors, then individuals and family health institution history, family and community resources and the utilization, because they should also know if they are referred somewhere else, they should have a knowledge where to refer them and how the utilization to be done. Okay, got it. That is a school health nurse. Okay, the community health nurse, I mean to say. Okay, it's okay. Then we'll stop here. Then tomorrow, next Wednesday, we'll do again. Okay, continue.